Another big question has always been that why is it that when I have vaginal infection, then take antibiotics, the infection still persists, it doesn't go? Why is it so? That is another question most females ask. Why is it that I have vaginal infections, take antibiotics, and then the infection persists? So let us look at some of the causes of such. So the first point is that it could be due to poor perineal hygiene. When I say poor perineal hygiene, some of the ladies might have poor perineal hygiene in that they possibly use one underwear for a long time, or during when they wash their underwear, they will not dry it in the sun, they will dry it in the room, then go to reuse it. Or possibly sometimes they use their pad for long, then do all those things can actually cause the persistence of the infection. And sometimes, so how we clean our anus, under normal circumstances, we are supposed to clean the anus, that is the females, they are supposed to clean from front to their back, but some mistakenly clean their anus from the back to the front, so wiping the anal bacteria into their private part. So that will cause persistence in the infection. Yes, so the second point is that antibiotic resistance. As I indicated in one of the videos, if you are a lady and you are found of abusing antibiotics, trust me, you always have frequent vaginal infection, because it will wipe off your normal flora, and then when your normal flora is wiped off, it means that you'll be prone to frequent infections, especially vaginal infections. Yes, so the third point is that it could be due to reinfection from your sexual partner. You know, some of the infections can actually affect the male partner as well. So if you, a lady, go for the treatment and the female and the man didn't go for the treatment, what it means is that when the lady is treated, the man will reintroduce the infection into you. Then you think that you were not treated. So if you want to prevent this, what happens is that when you treat yourself, make sure that your partner too gets treated. Then the fourth point is that non-compliance. Some of us, we don't comply to a treatment. They give you medication, take possibly every 12 hours, morning and evening. Then you decide that you take once in a day. Or possibly they tell you that, oh, take 3 times in a day. You decide to take 2 times in a day. Or they ask you to take it for 14 good days. Then you take it 3, 4, 5 days, then stop. So in such situations, the treatment will not work. The treatment will not work. So the fifth point is that wrong diagnosis. It could be due to wrong diagnosis. As I indicated, some vaginal discharges are just physiological. They are physiological. It's just the body's means of just lubricating the reproductive tract, or doing away with some aspects of the mucosa. Yes, so they don't